Hermes. I'm a financial advisor at Haran. Thank you so much for joining us this afternoon. We appreciate it. Today we're going to spend the next hour going over Social Security and Medicare planning. So with me today, I also have my colleague on the line. His name is Nate Epp. He's one of Haran's Medicare specialists and will tell you everything you need to know when it comes to applying for your Medicare benefit. For the first 30 minutes, we're going to focus on Social Security planning and everything you need to know there. One thing that I like to say before we begin is don't walk away from this feeling like you need to be an expert on any of these topics. Just know that you have a resource available to you should you have any questions. Haran does not charge a fee when it comes to Social Security and or Medicare planning. If you are working with a financial advisor or considering working with a financial advisor, it's also important to note that and make sure that you're working with a fiduciary. Essentially what a fiduciary is whoever you're working with has to have your best interests in mind when making recommendations. At Haran, all of our advisors are fiduciaries, and an easy way to know if you're working with one is if they have the letters CFP after their name. It stands for Certified Financial Planner. So as a CFP, we must act as a fiduciary at all times. And so with that being said, we're going to jump right into it today. On our agenda today, we're going to talk about how much you can expect to receive from your Social Security benefit and when you should actually apply for those benefits, along with different strategies you can utilize to maximize your benefit amount. Just a quick note, if you have a non-covered pension, which would apply to you if you have, for example, a state pension that you are contributing to instead of Social Security, how that could negatively impact your benefit amount, how your benefits are taxed, how you actually apply for your benefit, and ways to designate what's called a representative payee, which we'll get into as well. That was recently introduced here back in 2018, so it is relatively new. And lastly, how it all fits into your retirement picture. So hopefully everyone on this call today has taken a look at their Social Security statement before, and if you have, you would know that in the top right-hand corner, there's a big bold number, and that number is the amount that you are eligible to receive at your full retirement age, which we'll get into in a minute. But how are they coming up with your Social Security benefit amount? The national average benefit is around $1,500 per month. And what they're doing is they are using the highest 35 years of your earnings history, plugging it into a formula, adjusting it for inflation, and outspits your benefit amount, okay? But the key to remember is they're using the highest 35 years of your earnings history. And so when you get your statement, open it up to page 3, and it will list every single year you contributed to both Social Security and Medicare. So go through that page and double check your earnings history and make sure it looks accurate. Make sure you don't have any zeros in there for years you in fact did contribute to Social Security. The administration is about 99% accurate with their reporting history, which means they can mess up 1% of the time, right? And we've typically seen it happen to individuals who are ever self-employed. So go through, make sure you don't have any zeros in there for years you in fact did contribute, because if you do, it could negatively impact your benefit amount. If you go through and count up that you have 34 years of earnings history and you're contemplating working one more year to hit that 35th year, I promise you it is not worth it, okay? The amount that you'll pay in taxes versus what you'll get back out of the system, you have to live to be age roughly 160 to break even on that, okay? So point being, don't work just for the purpose of Social Security if you already have, call it 34 years of earnings. All right, but once again, they're using the highest 35 years of your earnings history. So go through your statement, double check it, make sure it looks accurate. If you've never received your statement before, I would encourage everyone on this call today to go onto socialsecurity.gov, and you can create an account and pull your statement and see what your benefit amount is and double check those earnings, okay? They'll ask you some questions based off of your credit history to make sure you are who you say you are, and then you can pull your statement at any time. The Social Security Administration is going green, so I believe they are no longer sending paper copies through the mail, or if they are, it's very sparingly. And once you do sign up for your Social Security account online, they will stop sending you paper copies in the mail. So just be cognizant of that. So as I alluded to before, when you get your Social Security statement, in the top right-hand corner, there's a big bold number. And that number is the amount you are eligible to receive at your full retirement age. So your full retirement age is when you can collect 100% of your Social Security retirement benefit. And your full retirement age is based upon the year you were born. So if you were born between 1943 and 1954, your full retirement age is 66. And if you were born after 1954, they kind of stagger it every 2 months going forward. And if you were born 1960 and later, your full retirement age is 67. So fun fact about Social Security, when it was first started, the full retirement age was 65, but most people only lived to be 65 years old. Nowadays, the latest full retirement age is 67, but most people are living to be in their early 80s. So benefits are getting paid out a lot longer than what they used to. So I wouldn't be surprised if they continue to extend this full retirement age later and later. But for purposes of today's presentation, those people getting ready to apply, their full retirement age is 66. And so I'll assume going forward in the rest of my examples that full retirement age and 66 are synonymous with each other. So when it comes to your Social Security benefit, you don't actually have to wait until your full retirement age to begin collecting. You can actually start your benefit amount at age 62. But each year you take it early, it's going to be discounted roughly 7% per year. And so if you look at that chart there, in the middle column, if your full retirement age is 66 and you start your benefit at age 62, you are going to receive 75% of your benefit amount. And once you've collected Social Security, you've collected it. And so that's the amount you're going to receive the rest of your life, okay? On the opposite end, each year you delay taking Social Security past your full retirement age until age 70, it will increase a guaranteed 8% per year. So not continuing to work, just delaying taking your benefit, it will increase a guaranteed 8% per year. So if once again your full retirement age is 66 and you wait until age 70 to begin collecting, you will receive 132% of your benefit amount. So I was actually working with a physician one time. He was age 72, and he said, "Mike, when should I start taking my Social Security benefit?" And I told him, well, you should have started taking it 2 years ago when he turned 70, because it doesn't continue to increase 8% anymore. There's no more delayed retirement credits, as they call it. And so he actually called up Social Security, and the most that they would lump sum him back was 6 months worth of missed payments. So he missed out on a 1.5 years worth of Social Security due to this mistake. So point being, never wait past age 70 to begin collecting, okay? Your age 62 amount, your full retirement age amount, and your age 70 amount are all highlighted on page 2 of your Social Security statement when you receive it. So when should you actually apply for your benefits? Just because your friends or family did one thing does not mean that is best for you. Everyone's situation is different. And if you ask 100 different advisors, you'll probably get 100 different answers. But here are some things to consider, some general rules of thumb. First is your health status. If you don't think you're going to live very long and you're single, you'll probably want to go ahead and start up your Social Security earlier than most people. Get as much out of the system as you can while you're still living, right? On the opposite end, life expectancy. So if you're in good health and your family has good longevity, it might make sense for you to wait until age 70 to begin collecting. So for example, if you wait until age 70 versus taking it at age 66, you're missing 4 years worth of checks by waiting, right? And so the break even on that is roughly age 82. And so if you think you're going to live longer than 82, it might make sense for you to wait until age 70 to begin collecting. Third is need for income. So if you're getting ready to retire and you don't have any other sources of income, you'll probably have to go ahead and start up your Social Security. Number 4 is whether or not you plan to work. This is a big one, and we see a lot of people mess this up all the time. With Social Security, there is something called the annual earnings test. What this says is if you collect Social Security before your full retirement age, so 62, 63, 64, 65, and you are still working at your job, you cannot make more than $18,240 per year, where Social Security is going to withhold a portion of your benefit amount. So typically what we see happen is you're 63, you retire, you start up your Social Security benefit, so it's discounted because you started it early, and then 6 months go by and you're bored, so you pick up some part-time work and end up making more than $18,240 a year. Then come January of next year, you get a nasty letter in the mail from Social Security stating that they overpaid you and that they're going to have to withhold your benefits, okay? So the key to remember here with this annual earnings test is if you start your Social Security before your full retirement age and you're still working, you cannot make more than $18,240 per year, or Social Security will withhold a portion of your benefit amount. January 1 of the year you reach your full retirement age, this earnings threshold goes up. You can now make up to $48,600 per year before you have to worry about Social Security withholding a portion of your benefit. And then the month you hit your full retirement age, so for me, November 1st of the year I turned 67, there's no more earnings test. I can make $1 million per year at my job and collect my full Social Security benefit without having to worry about any sort of penalties. So if you take nothing else away from this slide, just know that at your full retirement age, there's no more earnings test. You can make as much money as you want and collect your full Social Security retirement benefit without any repercussions. And so this is why typically we encourage people to wait until their full retirement age to begin collecting, so they don't have to worry about this. It's a nightmare when this does happen. And so another thing that's important to note is that $18,240 per year, those earnings test thresholds, that is only on earned income from wages and self-employment. If you're taking money out of your investment accounts or IRAs or 401ks, or if you're receiving a pension or you have rental property income, that does not count towards that earnings threshold number. It is only on earned income. But annual earnings test, full retirement age, there's no more earnings test. All right, so this is usually the part of the presentation when I get to it. Most people say, no wonder Social Security is going bankrupt, because there's ways you can collect Social Security benefits even if you never contributed into the system. And we're going to talk about some of the different strategies that you can utilize to hopefully get a greater benefit from your record. We like to say Social Security is like a drive-through. Okay, you go in, you tell them what you want, and hopefully they'll give you what you ask for. They're not going to make sure that you're utilizing the strategy that is best for your personal situation. They are not advisors, they are strictly order takers. Okay? So the first one we're going to talk about is a spousal benefit. If you are married, you can collect the greater of your personal retirement benefit or 50% of your spouse's benefit. So once again, you can get the greater of your personal retirement benefit or 50% of your spouse's benefit. You don't get both. A couple things to note about this. In order for you to be able to collect a spousal benefit, your spouse must be collecting their personal retirement benefit in order for you to take the spousal benefit off of their record. There used to be something called file and suspend. You can no longer do this anymore. So your spouse has to be collecting their retirement benefit in order for you to qualify for that 50% spousal benefit. You might have never contributed to Social Security in your life. You might have been a stay-at-home parent your entire career. You are still eligible to receive 50% of your spouse's benefit. With spousal benefits, just like regular Social Security retirement benefits, age 62 is the earliest you can begin collecting. But each year you begin collecting it early, it's going to be discounted roughly 7% per year. It's also important to note that there are no delayed retirement credits on a spousal benefit, meaning it's not, your 50% is not going to continue to increase 8% per year past your full retirement age. So if you are going to collect a spousal benefit, never wait past your full retirement age to do so. It's also important to note that with all of these strategies going forward, that annual earnings test applies. So if you are going to do one of these strategies and do it before your full retirement age, keep in mind that you cannot make more than $18,240 per year at your employer. So once again, spousal benefits, greater of your retirement benefit or 50% of your spouse's benefit. If you were married for at least 10 consecutive years, you may also qualify for a benefit, so ex-spousal benefits. Once again, if you were married for at least 10 consecutive years and you are currently divorced, you can get the greater of your benefit or 50% of your ex-spouse's benefit. So same thing as last time. If you remarry, though, you lose the ability to collect an ex-spousal benefit. All the same rules still apply, though. Age 62 is the earliest you can begin collecting a spousal benefit. Each year you take it early, though, it's going to be discounted. There's no delayed retirement credits past your full retirement age, and that earnings test still applies. It's important to note, though, that with ex-spousal benefits, unlike before when I said your spouse has to be collecting their retirement benefit in order for you to take a spousal benefit off their record, as long as you have been divorced for at least 2 years and your ex-spouse is at least age 62, you do not have to wait for them to begin collecting their retirement benefit. You can just go ahead and start up your spousal benefit. A couple tacky things about ex-spousal benefits. I could have been married 3 times, all of which lasted 10 years or more. I could have 3 ex-spouses collecting off my record. I don't know it's happening. It doesn't negatively impact my benefit, but I technically could have 3 ex-spouses collecting off my record. Or vice versa, instead of getting all 3, if I wanted to collect off one of their records, I don't get all 3. I just get 50% of whoever benefit I'm eligible for at that time, whoever has the highest benefit that I'm eligible for at that time. Number 3 on there is survivor benefits. So if you were married for at least 9 months and your spouse passes away, you can collect the greater of your personal retirement benefit or 100% of your deceased spouse's benefit. So unlike before where it was 50%, with survivor benefits, it is 100%. It's important to note, though, that you do not receive both your retirement benefit and a survivor benefit. You just get the greater of the 2. So you're going to get the greater of your retirement benefit or 100% of your deceased spouse's benefit. With survivor benefits, unlike before, where I said age 62 is the earliest you can begin collecting, with a survivor benefit, age 60 is the earliest you can begin collecting. But once again, each year you take it early, it's going to be discounted roughly 7% per year. Also, once again, there's no delayed retirement credits, so it won't continue to increase 8% per year past your full retirement age, and that annual earnings test still applies. One strategy that we'll often see couples use is the individual with the higher Social Security benefit will let theirs grow until age 70. That way, if they pass away, the surviving spouse can collect 100% of that increased benefit amount. So it acts as some additional insurance, essentially. Okay. Number 4 on there is ex-spousal survivor benefits. So once again, if you are married for at least 10 consecutive years and your ex-spouse passes away, you can collect the greater of your personal retirement benefit or 100% of your deceased ex-spouse's benefit. If you remarry after age 60, you can continue to collect this benefit amount. If you remarry before age 60, you lose the ability to collect that benefit. And so actually one time I had a client who was 59 and a half, who they had an ex-spouse that was deceased, who at age 60 could have began collecting their survivor benefit, but without knowing this rule, once again at age 59 and a half, they ended up getting remarried. So they lost the ability to collect that and lost out on about $2,500 per month of income. And so our recommendation to her was to temporarily get divorced from her current spouse for 6 months. When she turns age 60, start up her survivor benefit, and then after age 60, get remarried to her current spouse. And so in the eyes of Social Security, it's one of those loopholes where technically it would have worked, but for all of you wondering, she didn't actually go through with it. Number 5 is dependent benefits. So if you have a child who is under age 18 and you are collecting your Social Security, that child is eligible to collect 50% of your Social Security benefit through age 18 as long as they're enrolled in high school. And if you pass away, they are eligible to collect 75% of your benefit amount through age 18. typically what we see happen is you might have legally adopted a child. This rule still applies. They can still collect off of your record. All right, the last complicated strategy we're going to talk about today is the restricted application. Essentially, the way Social Security works now is under what's called deemed filing rules. So what that means is when you go to apply for your retirement benefit, if you are also eligible for a spousal benefit, you are applying for both at the same time, and you're just going to get the greater of the two. You do not have the ability to separate them so that they work independently. What a restricted application allows you to do is to separate your spousal benefit from your retirement benefit so that they do work independently. And so with a restricted application, this is getting phased out, but I've seen this strategy make the difference of roughly $130,000 over the course of someone's life. So if you're eligible to do this strategy, I would strongly encourage you to do it. Once again, I said this is getting phased out, so you can only do this if you or your spouse were born before January 2nd of 1954. Okay? Once again, the magical date here is if you were born before January 2nd of 1954. And once again, it allows you to separate your retirement benefit from your spousal benefit. So let's take a look at this example. Mike and Jane are 66. Mike was born before January 2nd of 1954, so he's eligible to restrict his Social Security application. Mike is eligible for $2,000 a month off his personal benefit, and Jane's eligible for $800 a month off her benefit. What Jane's going to do is she's going to start up her personal retirement benefit and begin collecting $800 per month. Mike is then going to restrict his Social Security application and begin collecting half of Jane's benefit amount and receive $400 per month in a spousal benefit. Because his Social Security, because he restricted his application, his personal retirement benefit is going to continue to grow $2,000 or continue to grow 8% per year until age 70. So that when he turns age 70, he's going to flip from his spousal benefit of $400 per month to his retirement benefit that's grown to $2,640 per month. And now that he's collecting his retirement benefit, Jane can switch from her retirement benefit to her spousal benefit and receive half of Mike's benefit amount that he would have been eligible for at his full retirement age, or $1,000 a month in this case. And so essentially all a restricted application is you're going to collect a free spousal benefit from your full retirement age until age 70, and your personal retirement benefit is going to continue to grow 8% per year. Once again, don't feel like you have to be an expert in any of these strategies. Just know that you have a resource to you. Should you have any questions, we're happy to walk you through what strategy is best for your personal situation. With Social Security, there's something called the windfall elimination provision and government pension offset rules. These are very complicated rules, and these only apply to individuals with non-covered pensions. So pensions that they were contributing to, either state or government pensions, instead of Social Security. And so being in Ohio, the two most common ones are the state teachers retirement system and the Ohio public employee retirement system. And so just know that if you or your spouse has one of these non-covered pensions, that a lot of those strategies that we previously talked about might not be eligible for you. So if you have questions around how windfall or government pension offset could impact your benefit amount, please let me know, and we can walk through exactly what that impact is for you. All right, taxes on Social Security. So it's important to note that when you begin receiving your benefit amount, your Social Security is subject to federal income tax. There is no state or local tax in Ohio, Kentucky, or Indiana. If you're planning on moving to a state other than that, be sure to double check that state's tax rules. Some states do tax a portion, if not all, of Social Security. But for purpose of today, the reason I bring this up is when you apply for your Social Security benefit, the administration does not ask if you would like to withhold anything for taxes. And so make sure you tell them, yes, I would like to withhold something for federal income tax. Because if you don't, more than likely, come next April, you're going to owe Uncle Sam a tax bill. Okay? So you can choose between 7, 10, 12, and 22%. So for most retirees, a 10 to 12% federal income tax withholding is enough. And so you can change that tax withholding at any time also. But once again, Social Security does not ask if you would like to withhold anything for tax. So make sure when you apply for your benefit, you tell them you want to withhold something for federal income tax. Now you know what strategy that you want to do and you know how much you want to withhold for tax and you're ready to apply for your benefit. It's important to note that the earliest you can file for or start the process to file for your benefit is 3 months before you would like to begin collecting. And you have three options as to how you can do that. You can either visit your local Social Security office. You can call and schedule a phone appointment. There's the 1-800 number. We would encourage you to call at 7 a.m. to avoid the wait on the phones. Or 3, and we help people do this all the time, you can file for your benefits online. It takes about 30 minutes. They ask some questions, you hit submit, and then you get a letter in the mail notifying you of your benefit amount. The important thing to note about this way is you cannot, filing for your benefit this way is you cannot file for a survivor benefit. You have to visit your local Social Security office or call Social Security to file a survivor benefit. But once again, 3 months before you want to begin collecting is the earliest you can apply. So if you want to start collecting at your full retirement age, we'll say in April, you can start the application in January and designate you want your benefit to begin in April. And it's important to note that you don't actually receive your first check until 1 month later. So Social Security pays their checks a month in arrears. So in that case, you won't receive your check until May. So make sure that you have enough cash sitting on the sidelines to get you by for 1 month until you receive your first Social Security payment. And the date that your Social Security comes is based upon the day of the month you were born. And so if you were born the 1st through the 10th, you will receive your check the 2nd Wednesday of the following month. If you were born the 11th through the 20th, you'll receive your check the 3rd Wednesday of the following month, and the 21st through the 31st is the 4th Wednesday. Something new in Social Security this year, or back in 2018, it's important to note that Social Security does not recognize financial powers of attorney. So if you have a legal document in place that says who can access your money and make financial decisions for you on your behalf, if you were to ever become mentally incompetent to do so yourself, Social Security Administration does not recognize those legal documents. And so once you apply for your Social Security benefit, you can appoint up to 3 individuals who can make decisions for you on your behalf should you ever become mentally incompetent. So it's important to remember, once you begin collecting Social Security, to name up to 3 of these individuals for you who can make decisions on your behalf. All right, last slide here. I work a lot with retirees, current and upcoming retirees. It's all I specialize in. And I think the biggest question that I get is, Mike, I have all these different accounts. How much money can I live off of in retirement without running out of money? That's the biggest question people want to know, is what can they live off of without running out of money, okay? And so here's the quick way of figuring this out. What you're going to do is you're going to add up all your investment accounts, so 401ks, IRAs, 403bs, et cetera, add them all up into one big pot. A typical conservative retiree portfolio, on average, should make between 4 to 5% per year. So the whole idea is you make 4 to 5% and you take 4 to 5%. So your accounts kind of stay the same over time. So if you have $100,000 saved up in investment accounts and you take 5% per year, that's $5,000 per year you can take from your investments. You're going to divide that by 12 to get a monthly amount. So roughly call it $440 per month. So you have $440 per month you can take from your investments, and you're going to add that to your monthly Social Security check and any monthly pensions you might be eligible for, and any monthly annuities as well. And that's how much income you have coming in every month. So when you're budgeting for retirement, every retiree should have a budget. So when you're budgeting for retirement, try to make sure that your expenses are in line with whatever that income number is. We help individuals figure this out all the time. Once again, we do not charge for consultations, so if you ever have a question, just let us know. We're always happy to help out. Here's my contact information. We appreciate everyone joining today. It's important to note also that afterwards we will be sending out copies of the slides as well as a recording of the presentation. So if you miss anything today, don't worry, you'll have all those resources available to you. So with that being said, I'm going to stick around to answer any questions in the Q&A session, and I'm going to hand it off to Nate Epp to talk about Medicare.
Thanks, Mike. Awesome job as always. Always do great with that. Bear with me, folks, just a moment while I switch to my screen. Not that one. All right. And I'll echo what Mike said here. We're just throwing a lot of information at you all at once. So, you know, don't put a lot of pressure on yourself to feel like you have to memorize everything that we're going over today. Just know that you have some resources here at Haran that will help you with this when that time comes. And also, when it comes to Haran and how we kind of fit into this Medicare maze, is we are what they call an independent broker. So our role is to simply guide you and help you figure out when the transition to Medicare, exactly what steps you need to take to make that transition, and also to review what insurance plans are out there that best fit your particular needs. So we contract with about 10 different insurance companies, and we help you navigate all of those and narrow it down to the one that best fits your particular situation. So there's no fees, like Mike said, to get our assistance, so you're welcome to reach out at any time. All right, so we're just going to jump right in, and on the right side of your screen, there's a little chat box. If you have any questions, type them in the chat box, and we'll address them at the end. All right, Medicare started in 1965, and it is designed for 3 groups of individuals. The first group are those who qualify for Medicare based on their age. So you are first eligible to start Medicare the first of your birth month. Okay, so wherever your birthday falls in a month, if your birthday is November 10th, you can start Medicare November 1st. Okay, so your first eligible always goes back up to the first of your birth month. If your birthday happens to be on the first of the month, you can actually start a month earlier. So there is an exception to that. But for everyone else, first of your birth month. Second group of individuals are those who qualify for Medicare because they are on Social Security disability. Okay, so this can be of any age. So we have some clients in their 40s and 50s that are on Medicare already because they've been on disability for 24 months. Once you're on disability for 24 months, you're automatically enrolled in Medicare on your 25th month, so 2 years on disability. All right, third group of individuals are those, again, of any age, those who are diagnosed with end-stage renal disease, permanent kidney failure, or ALS, Lou Gehrig's disease. A diagnosis of either of those, you also qualify for Medicare. All right, so those are your 3 groups, and Medicare has 4 parts, A, B, C, and D. It's going to kind of feel like we're going through half the alphabet today, but just so you know, there are two main components to this whole puzzle. The parts A and B, that's the government side of Medicare. Okay, so the 2 components are government and insurance. On the government side, it's Part A and Part B. Everything else, Part C, Part D, there's another product called Medicare Supplement. That's all, those are private health insurance plans sold by insurance companies. Okay, so there's a government component and an insurance component, and the purpose of today is kind of show you exactly how those work together. All right, so those are your 4 parts. And myths of Medicare. There's a lot of rules. If you've tried to do any research on your own, you have found, I'm sure, that it is complicated, confusing, and it's kind of hard to figure out based on your personal situation. You know, what are the rules? How do they apply to you? And what do you need to do? So there's quite a few of them. I've kind of boiled it down to the 2 that I have found that are the most common that I hear pretty much every day. So the first one here, this is a myth, is that a lot of people I talk to believe that you have to sign up at 65. That is actually true for some individuals, but it's not true for everyone. Okay, so here's a very important rule that you need to know. The rule is Medicare says that as long as you have health coverage through your employer, and as long as that company has 20 or more employees, obviously TriHealth does, then you do not have to sign up for Medicare at 65. So if you are working and you plan to continue working and you are satisfied with your current insurance and you don't want to change it, you want to stay on it and just keep on working, just keep it going. You do not have to sign up for Medicare at 65. You are allowed to delay Medicare until you are ready to come off that employer plan, and there is no penalty with that delay. Okay? That rule I just mentioned also applies to a spouse. So if you have a spouse turning 65, same rule. They're allowed to just simply stay on your health plan, and they do not have to come off. They don't have to sign up for Medicare. Both, you can simply just stay on. Now, with that said, turning 65, that does count as a qualifying event. That does allow you to come off of your employer plan if you want to. Now, whether that is a good idea for you or not depends on many things. So it depends on how much does the plan cost at work? What are the benefits? Does that plan meet your needs? And then lastly, how does that compare to Medicare? So with this presentation today, I'll give you an idea of what the options look like on Medicare, what the coverage looks like, how much does it cost, and then you can compare that to what you have and just see which one makes the most sense. So just a quick recap again. If you're turning 65, if you're planning to keep on working, option number one, you do not have to sign up for Medicare. You can delay it until you're ready to retire. Okay? Number two, so I hear this very frequently, health savings accounts are becoming increasingly popular with employers, and there's a lot of rules with that, unfortunately. And one of those myths around HSAs is that you can't have one once you hit age 65. Okay, so that has nothing to do with your age. It has to do with whether you are enrolled in Medicare or not. Okay, so Medicare says that as soon as you enroll into any part of Medicare, you can no longer put money into that HSA at that point. Okay, so I hear this all the time. People call me up and say, "Hey, I'm turning 65. Someone told me that I should, just sign up for Part A of Medicare." Because Part A is free, you don't pay for Part A, there's no charge, and it will act as a secondary insurance plan to your employer plan. Okay, so some people do sign up for A. Whether you should or should not actually depends on what type of employer plan you have. Okay, so if you're on an HSA, our advice is do not sign up for Part A at 65. That way you can continue putting money into that HSA. But if you're not on an HSA, let's say you're on a more traditional PPO style plan or FSA or an HRA, any other types of plans are fine. You can go ahead and sign up for A, and there's no downside to that at all. Okay, it's just the HSA. If you're enrolled in Medicare, you can no longer put money into that account. We have a couple slides at the end about HSAs, and we'll go over a few more details that you need to know. But these are the two main myths that I hear very frequently. All right, let's jump into those four parts that we mentioned at the beginning. So this is Part A. This is one of the two parts that you get through the government. And again, there's no cost to Part A as long as you or your spouse, either one of you, have worked at least 10 years of your life paying Medicare taxes. At that stage in life, that's about 99% of the population have met that requirement. So no charge to Part A. Now, what's covered under Part A? So that's all of your inpatient hospital expenses, that's skilled nursing facility, hospice. Now, one big myth that I also hear about Medicare is a lot of people believe it just covers all of your expenses. And that is not the case. So Medicare covers a portion of your expenses, and it leaves you responsible for a portion. So I'm not going to go into great detail. We don't have enough time for that today, but just so you know, if you get admitted to the hospital, there is a deductible here. $1,484, that's your deductible. Medicare pays the rest, but that deductible resets every 60 days. So if you get out of the hospital and 60 days go by and you happen to go into the hospital again, they'll charge you another $1,484. Okay, so if you have a rough year and have multiple trips to the hospital, there's a chance you might be charged multiple times for that deductible. Okay, that's not a calendar year deductible under Part A. It's a benefit period that resets every 60 days. So the moral of the story, the message that we try to hit home here when we do this presentation is it is great that Medicare provides this benefit as a base coverage, but you want to have something in addition to Medicare. You want to have some other insurance plan to help cover some of these expenses. There are some products that cover all of these expenses, which we'll get into here pretty soon. Okay, but that's Part A of Medicare. Under Part B of Medicare, now this is important because as you are planning transitioning to Medicare, okay, and you're trying to figure out how much is this going to cost? How much is Medicare going to cost you? This is the first dollar amount that you're going to write down. So if you're taking notes, this is an important number to jot down. There is a monthly payment to Part B. It's $148.50 a month. That is per person. So if you're going through this with a spouse, that's for each of you. You'll see in parentheses here that it can be adjusted based on income. So I'm not going to go into great detail with this, but just know that the year that you transition to Medicare, they actually look at your tax return from 2 years ago. They look at your AGI, and whatever that dollar amount is, there are like 6 different income brackets. So if you happen to be in a higher bracket, they could charge you more for Part B. I think the threshold for next year is $176,000 a year for a couple and $88,000 for an individual. If you make over that, then they will charge you more. Okay, so for today's purposes, we're just going to use the $148.50 as our amount. All right, so Part A, remember back on Part A, it's all of your inpatient hospital expenses. Under Part B, that's all of your outpatient. There's a lot of medical expenses that roll up under outpatient expenses. That's primary care doctor, that's specialist, that's ambulance, that's any kind of tests that are run, outpatient rehab, medical equipment. All those expenses roll up under Part B. You do have a calendar year deductible. Now that is a one-time deductible. You cover $203. After that, for the rest of the year, Medicare picks up 80% of your expenses. You cover 20. Okay, so that's having Medicare just by itself. They automatically pick up 80% of your expenses, which is good. That's a pretty big chunk of your expenses being covered. The issue is with Medicare by itself, that 20% that you're responsible for, there is no cap. There is no limit to that. Okay, so if you don't have any additional insurance plans, you're paying 20% of all of your expenses up to an unlimited amount. So it's important to have something in addition to this to help put a cap to those expenses. And there are some products that cover that entire 20%. So we'll get into that here on the next slide. But that is Part A and Part B. That's the government portion of Medicare, and that's the cost and the coverage of both. Okay, Medicare Roadmap. So when I'm having a one-on-one session with someone for the first time and we're trying to just kind of understand, once you're on Medicare, then what are your options? What do you do at that point? So now we're going to get into those insurance products that are going to help cover some of these expenses. All right, I'm going to pull those up down here at the bottom, but I want to mention just a couple quick things about A and B. Okay, so as you are planning this transition to Medicare, this is step number 1, is applying for Part A and Part B. That's the very first thing you have to do. Okay, you can do that online. Go to ssa.gov, that's Social Security's website. That's actually where they house the Medicare application, the online application. You are allowed to apply for Medicare once you're within 90 days of when you need to start. Okay, so whenever you want to start on Medicare, take that back 90 days, and that's the earliest you can actually start that process. And I do recommend that try to start it as early as you can. So as soon as you cross into that 90-day window, fill out your application for A and B. Takes a couple weeks to get approved. Once you're approved, they'll send you a letter that says, here's your Medicare number. Once you get that Medicare number, then you're allowed to take the next step, which is signing up for one of these 2 options. You have the option to go with either a Medicare Advantage plan or Medicare Supplement. You'll hear the term Medigap sometimes. Same thing, Medicare Supplement, Medigap. But those are your 2 options to consider. Now, before we jump in, just so you know, the costs we just talked about. So Part B has that monthly payment of $148.50. Doesn't matter what you sign up for, whether it's Advantage or Supplement, that's a payment that you're always going to make. Okay, that's a constant number, the $148 a month. Okay, so this would be in addition to that $148. So I'm going to go through the kind of the pros and cons of each of these plan types to give you an idea what those look like. All right, we'll start with Medicare Advantage. So under a Medicare Advantage plan, what's really attractive are a couple things. The first thing is the monthly payment. Okay, those Advantage plans, most of them are actually $0 per month. So if you're anywhere near age 65 right now, I know that you're getting bombarded with tons of mail, email, phone calls, all trying to sell you an insurance plan. Most of it says, sign up for us, and it's $0 per month. And you see commercials on TV for it as well. That's what they're trying to sell you, Medicare Advantage plan. Okay, no monthly payment, but what you do pay for are copays for your medical expenses. Okay, so there's a copay for just about everything. It's either a copay or like a small percentage. So you're paying, for example, a $10 copay when you see your doctor. If you see a specialist, it's usually higher, $40 copay. Emergency room visit, $90 copay. If you spend a day in the hospital, $350 copay for each day that you're in there. Everything has a dollar amount that you're responsible for. So, and just like the health plan that you're currently on, this Advantage plan has what they call an out-of-pocket maximum. Okay, there's a limit that says that if you end up spending this much money out of your pocket in copays, then at that point, your medical expenses are covered 100% for the rest of the year. Okay, and that out-of-pocket maximum, that limit is usually $4,000 to $5,000. Okay, takes a lot of expenses to hit that $4,000 to $5,000 because you're paying small copays up to that point, but that would be your worst case scenario. That would be the most you would spend in a year in medical expenses if you're on an Advantage plan. Another attractive thing about an Advantage plan is that they usually throw in other added benefits like dental and vision and hearing. That's usually added in there as well, in addition to your copays for doctor and hospital. Now, the drug coverage of Medicare, that's called Part D. Okay, D is in drugs. Part D of Medicare is included at no additional cost. So you also have copays for prescriptions built into that plan as well. So they bundle copays for doctor, pharmacy, hospital, dental, vision. They kind of lump it all together into one plan for no monthly payment. Now, what's important with an Advantage plan is that you have networks of providers. Okay, so Advantage plans, when you sign up for those, what you're doing is you're actually replacing Medicare as your insurance. Okay, you're not actually using your Medicare card. Okay, you're using this Advantage insurance company card. Whether it's whoever it is, Anthem, Humana, United Healthcare, whatever you sign up for, you're using that card for everything. So that means you have to stay in that insurance company's network. So that's part of my job. Is if you're interested in an Advantage plan, I'll ask you for a list of any doctors or hospitals that are really important to you, and then help you narrow down which plans best fit your list of providers. Obviously, we want to make sure that you're signing up for a plan that has all of your providers in network. All right. So that's an important part of figuring that out. So that's a basic crash course in Advantage plans. And then on the other side is Medicare Supplement. And it is pretty much an exact opposite of everything that I just went over about Advantage. So it's the opposite concept. So instead of having no monthly payment, you do have a monthly payment, which is based on age and gender and where you live. And for example, there's a supplement plan. It's the most commonly purchased supplement plan today. It's called Plan G. The monthly payment for Plan G is averages about $110 to $120 a month, somewhere in that range for most folks. So it's a higher monthly payment, but you have a very small deductible that you are responsible for, and that's it. And actually, it's back here at this Part B. It's this calendar year deductible, $203 deductible under Part B. You're responsible for that. Once you cover the first $203 of your medical expenses, the supplement plan picks up all of your medical expenses after that 100%. So it covers that remaining 20%. All these expenses under Part A, it covers all of that 100%. Okay, so your maximum out of pocket for the year is just your $203 deductible. Okay, so it's a lot lower than the Advantage, but it also costs a lot more as well. So that's something that you have to consider when you're making this choice. So a couple more things about a supplement plan is that the drug coverage is not included. Okay, so that's why there's a plus sign here, and there's a separate column for Part D. So they split your medical benefits and your drug benefits into two separate plans. So you have a monthly payment here, then you have a separate monthly payment here. It says here the national average is $33. The average in Ohio, Kentucky, Indiana, kind of in this tri-state area, is around $15, $20 a month, usually around there for a drug plan. So you have two monthly payments here when you go this route. Now, another big difference between an Advantage and a supplement are the network of providers. So remember, over here on Advantage, you have to stay in the insurance company's network. That's not how that works over here on a supplement. Doesn't even matter what insurance company you pick over here. Your network of providers is not based on your insurance company. The network is up here. It's Medicare. Okay, so the supplement plan, it does not replace Medicare. The name kind of says what it does. It supplements Medicare. So Medicare is considered your primary insurance, which means you can go to any doctor in any hospital in the entire United States. As long as they accept Medicare, then your supplement has to cover the expense. Okay, so if you have any plans on, frequent travel or, spending a decent amount of time in another state, then you don't have to worry about networks of providers when you're on a supplement plan. Okay, now that's your crash course in the two options that you have to choose from. And I get this question a lot. This is a pretty logical question after I get done is, well, can I just switch around from one plan to another? And the answer is maybe. There's a catch to this stuff. Okay, so here's a very important rule that you need to know. When you first get enrolled into Part B of Medicare, not the date you sign up for Part A, but the enrollment date for Part B, when you sign up for B, there is a 6-month window where you can sign up for any supplement plan you want through any company that you want, and your enrollment is guaranteed. It doesn't matter your health history, doesn't matter if you're healthy, if you're sick, you can sign up for any plan that you want, and it's yours. Now, once that 6-month window has passed, then in order to get onto a supplement plan at that point, now you have to qualify based on your health. So if you take an Advantage plan first, and let's say a couple years go by, and you decide that you want to switch from an Advantage over to a supplement plan, then you will have to answer these health questions on an application. Most of them are very, serious medical conditions, like have you had a heart attack or stroke or cancer in the last 3 years? Have you been in the hospital recently, or do you need to have surgery? And they will decide whether they will allow you to switch or not based on your health. I just switched one of my clients this morning from an Advantage to a supplement, and she's going to be fine. She went a couple years and nothing happened, and she's fine. She's going to be able to switch. On the other hand, I've had people take an Advantage and get an unfortunate diagnosis and then want to switch to a supplement, and it's too late at that point. Okay, so that's an important part of trying to figure out what route to take. Is you got to keep in mind that supplements are only guaranteed when you first get on Medicare. Okay. Now, if you want to switch from a supplement to an Advantage, if you want to go that route, that's fine. They'll always let you make that switch. It's just going from an Advantage to a supplement. That's when you have to qualify based on health. Okay. All right, moving on. We got a few more slides to go through here. Okay, I'm not going to go into great depth on this, but there is a term in Medicare called the donut hole. Okay, if you've heard that term before, this is what it's referring to. It's referring to the prescription coverage of Medicare. I'm not going to get into the weeds here with the finite details of this. It's pretty much the most confusing part of Medicare, in my opinion. So I won't unload everything on you here, but just know that there are 4 stages of prescription coverage. There's your deductible stage. There's this initial coverage period stage. This is a stage of prescriptions. Now, when you're in this stage, Medicare is keeping track of how much you're spending. They're also keeping track of how much the insurance company is spending on your prescriptions. Okay, so it's a combination of what you're spending and insurance is spending. And if that combination of expenses reaches $4,130, then you are moved into this next stage. You don't have copays for your prescriptions anymore. You are now paying a percentage of your medications. You're paying 25% of generic and 25% of brand name. Now, you're going to continue paying your 25%, and the remainder, 70% of what's left over, they're using that number to accumulate towards another maximum. This is $65.50. Now, if your prescription expenses ever reach $65.50, and again, that's not all out of your pocket. It's actually mostly out of the insurance company pocket, but it's a combination of your pocket, insurance company pocket. If it ever reaches $65.50, you're now out of the donut hole, and you've hit the final stage where you're not going to pay any more than 5% of your medications. Wow, right? Who comes up with this stuff? I don't see anybody on the call, but I know most of you are doing, shaking your head side to side, who comes up with this stuff, right? So again, that's part of my job is, when you're ready to make this transition, I'll ask you for a list of any medications that you take. We have a little software that shows me, what drug plan best covers your particular list of meds. And it also shows me, if you're going to hit the donut hole, what month you're going to hit that. If you're going to get out of the donut hole, what month that's going to happen in, what your costs are going to be. So I show that to you so you know exactly what your year is going to look like. Most people don't hit the donut hole, but I definitely have clients that hit it because their medications are so expensive. Everybody's different. It just depends on how many medications you're taking, how expensive they are. That determines your experience in this. But I'm able to show that to you. All right. Moving on here, we have just a couple more slides, and then we're all done, and we'll move over to the chat questions. All right. There are two penalties in Medicare that you need to be aware of. I'm not going to spend too much time on that because, first off, the Part B penalty is what I already mentioned at the beginning. The Part B penalty says that as long as you have coverage through your employer or a spouse's employer, and as long as that company has 20 or more employees, then you're fine. You don't have to enroll in Medicare. There will be no Part B penalty as long as you're covered under that plan. Okay. The Part D penalty goes one step further, and it says that if you have coverage through your employer, it has to be good enough according to Medicare. It has to meet Medicare standards when it comes to prescription coverage. And all of your plans at TriHealth, they are what they call creditable. That's the term that they use. So you don't have to worry about the Part D penalty either. Okay, so no penalties to worry about as long as you maintain that health coverage through TriHealth. All right, HSAs, 2 slides and we're all done, all right? So keep in mind a couple things about HSAs. The first is collecting Social Security. So keep in mind there's a little bit of a domino effect here of when you start collecting Social Security. If you're over the age of 65, you are automatically enrolled in Medicare when you start drawing Social Security. Okay, they will enroll you into Part A of Medicare, and that goes back to that rule that we talked about. Remember that as soon as you are enrolled in Medicare, you can't put money into your HSA. So basically, if you plan on drawing Social Security, that also means you got to stop your HSA contributions at that time. So so that's just something to consider as you're trying to decide at what age do you start collecting Social Security. So that rule that I just mentioned about being enrolled into Medicare and not being able to contribute to your HSA once that happens, that only applies to you as the employee. They don't care if your spouse is employed in Medicare. They don't look at that, okay? So if your spouse enrolls into Medicare or if they start collecting Social Security, no impact at all, okay? You can still contribute up to the family maximum. You can still use that money for your spouse's medical expenses. There's literally no impact. It's just you. Are you enrolled in Medicare? That's what they care about, okay? Here's the contribution limits for next year: $3,600 single, $7,200 family. You can add another grand to each of those columns if you are over the age of 55. And when you transition to Medicare, and let's say you have money sitting in this HSA, now what? You can't put any more money into it, but what can you use it on? Not only can you use it just like you're using it now, so for co-pays, for doctor visits or prescriptions or your deductible, but you can also use it for your premiums, okay? So Part B premium, remember that Part B premium, $148 a month, you can use your HSA money for that, or your drug plan premium, you can use your HSA money for that. The only thing you can't use your HSA money on in Medicare are your Medicare supplement premiums, your Medigap premium. I don't know why, but they won't let you, okay? I know we're short on time here. We just hit 5 o'clock, and I just want to wrap up with one last rule that you need to know. This is another kind of head shaker in Medicare, but just be aware, whoops, going back, just be aware that if you delay Medicare, okay, so if you hit age 65, you plan to keep on working. If you delay Medicare until a later date, just be aware that when you go to sign up for Medicare, they will start Part B whenever you need them to start. But Part A will be retroactively started back 6 months. There's no charge to Part A, so you don't have to pay anything back. However, remember that as soon as you are enrolled in Medicare, you can't put money into your HSA. So because they take Part A back 6 months, that means that you have to stop your HSA contribution 6 months prior to enrolling into Medicare. Okay, I know who comes up with this stuff. Very complicated, I know, but again, that's our role here is when you're ready to make that transition, when you have a retirement date in mind, that's part of our job is to help put a timeline together for you. We'll let you know, as of this date, make sure you stop your HSA contributions. As of this date, make sure you sign up for Medicare. We walk you through step by step through the whole process so you don't miss anything, and you make a nice, easy, smooth transition. Okay. Last page here is just a list of resources. My contact information in the top left. I have another gal in my office named Heather. She does a great job. Same thing I do, and some other resources there. But we're all done with the presentation. We will send an email out with a copy of the presentation along with a recording. And if you've had enough for today, you're free to go. We thank you so much for joining. If there's any questions in the chat box, we're going to hang on here for a few more minutes, and we're going to help answer those questions. So if you don't have any questions, you're welcome to hang up, and thank you so much for joining. If you want to hang on and listen to the answers to your questions, we will do